Good morning. Thank you all for coming. I'm really excited to be here. So this is our pop session for this week, and the topic and theme for today is the Pozen-Commonwealth Fund Fellowship Program here at Yale. So we're really excited to welcome you all here, and we also want to welcome the prospective students that are Zooming in with us today. So as we all know, the pop sessions are an opportunity for us to get to know each other and just hear about the exciting work that we're all doing. So we're just going to get started. We'll start with the introductions. And I'll start with myself, and then we'll get into the panelists, who are, of course, like the main event for today. So my name is Katie Spies. I'm a member of the class of 2020. I'm a nurse and a midwife. I've been a nurse for 16 years and a midwife for 9 years. And I originally decided to become a midwife because I discovered the maternal mortality statistics in the US, which are abysmal. Women in the US die at twice the rate of women in other industrialized countries. And even more appalling is the fact that racial disparities really dictate who dies in childbirth and who doesn't. So we're going to hear a lot about racial disparities here today, but that really drove my interest in becoming a midwife. So I went to nursing school, and my first job out of nursing school was working on a labor and delivery unit here in Waterbury, in Connecticut, with a population that's very socially and medically high risk. The people who are going to bear the burden of the disparities that we're going to talk about today. And I was fortunate to have that job because most hospitals will not hire new grads to labor and delivery. They usually want you to work on a med-surg floor, so I was very lucky to not have to do that. And then I worked at that job until I graduated from the Yale School of Nursing with my midwifery degree, and immediately took a job doing something pretty much the complete opposite end of the spectrum. I went to work for a freestanding birth center in Danbury, which is a very different population. It's mostly affluent women with partners and stable financial situations who have a lot of thoughts about how they want their birth experiences to go. And which is great. I actually, it's the best job I've ever had. I loved it. I never thought I would leave. Just to note, this very low risk, highly affluent population is where I had my maternal death. And so even though we're going to talk about disparities, just keep in mind that mortality happens everywhere, and we can't take our eye off the ball in any situation. And so I did eventually leave that job, and went back to Waterbury for a little bit, and then that practice got sold, and so now I'm working in a private practice in Middletown, which is also in Connecticut. We have sort of a mixed population, but through the history of my clinical career, I've really seen the full gamut of how our healthcare system impacts our outcomes, and I'm really excited to be back at Yale for the second time at SOM this time, because I think that if we want to really change outcomes, we have to think about the entire ecosystem of healthcare and not just clinicians and providers. So with that, I would like to introduce. We can start with Cece.
Good morning, everybody. I know most of you guys. I'm Cece Calhoun. I'm a pediatric hematologist, oncologist at Washington University in St. Louis and St. Louis Children's Hospital. I am from Detroit, and I did all of my academic training there until I moved to St. Louis for fellowship at WashU, where my clinical and research interests center around the care of children with sickle cell disease, particularly adolescents and young adults as they transition from pediatric to adult care, because what the data shows us is that's the highest time of morbidity and mortality in this population. And much like Katie, I was like, I'm gonna go do this healthcare disparities, and I know how to fix this with my fellowship project. I'm gonna just improve knowledge. But as I got started, I recognized that we're trying to have patients and providers function in a system that's broken. And so in order to kind of remedy that and further understand that, that's why I came to Yale. Thankful for the opportunity for the Pozen-Commonwealth Fellowship to add some granularity, some systems knowledge, some operations knowledge to a really challenging problem. So that's it.
Good morning, my name is Kanita Gaines, and I am the Director of Nursing for Vinasemi Clinic, which is part of the UCLA healthcare system. And I am originally from San Francisco, but I moved down to Los Angeles to pursue my graduate education at UCLA. And so I have my master's degree in African American Studies, and I had the opportunities to study under Dr. Brenda Stevenson, who is a premier scholar on American slavery. And then also she actually studied under John Blassingame, who was here at Yale, and he was the head of the African American Studies Department for about 29 years, and he was the preeminent scholar on American slavery. And from that, I studied structural inequalities of minority communities, and specifically looking at critical race theory and how race, politics, and law help to shape our framework in our society. And so from that, just looking at how systemic racism actually affects healthcare and looking at that for different minority communities. From that point on, I went and I got my master's degree in urban planning. And I studied and really looked at the accessibility of quality healthcare facilities for minority communities and within the built environment and how that affects the care that they get. And then from that point, I really started to look at how I wanted to have more of a direct impact with patients and communities. And so then I decided that either I was going to get my master's in public health or get my master's in nursing. And so I talked to some of the deans for both of the programs, and I decided that nursing was really my calling. And so I went to nursing school, and while I was in nursing school, I actually had the opportunity to work for the pediatric, so the Perinatal Quality Care Collaborative, and it's a state-run database that collects data on infants that are placed in the NICU, which is a neonatal intensive care unit. And when I was there, I started to realize, I started to see trends. So similar to what Katie was saying, that most African-American infants were dying at higher rates. They were being born prematurely, and then they were also being born with low birth weight. And so that really piqued my interest in perinatal outcomes and maternal outcomes, specifically for communities of color. And so I became a NICU nurse, and I worked there for a few years. And then I went into nursing leadership from that point. And I've worked at large community hospitals, small community hospitals, large academic medical centers. So really looking at how to impact care, inpatient, and now currently working outpatient. And I'm finishing up my Doctor of Nursing practice here at Yale. I'm in my third year right now, and also getting my my MBA. And so, but I think with my DNP program, it's really focused on how really understanding healthcare systems. And I wasn't a business major. I don't have a business background. So I really wanted to understand the business acumen of how healthcare systems run and how they function. And so one of the reasons why I'm here in the program, and I'm so grateful for the Pozen-Commonwealth Fund and what they've been able to do, and being part of this inaugural class. Sorry.
Don't say sorry.
I talked too much, sorry.
You did not. Hello, everybody. I am Crystal Yates, born and raised in Philadelphia, Cece. So I work for the Philadelphia Fire Department. I got there in a not a traditional way. Each parent in the audience that has more than one child knows that one of them is the special child. That was me. So I went to nursing school out of high school, and one semester before I graduated, I decided I am not doing this. My mother had already purchased my graduation present, and she was like, oh my goodness, please. I was like, no, I'm not. And I think I was young. I was one of those kids that graduated high school at 17, and I don't think I was really ready for the responsibility. So I left and got a job in insurance. I worked for Prudential Insurance Company. Then I worked at Drexel University, because I think the world was saying, or God, was saying, Crystal, you need to finish your education. So one of the nurses I worked with at Prudential, her husband was a dean at the College of Engineering at Drexel University. Crystal, you need to go back to school. My husband has a position. Go there, go back to school. It'll be paid for. Did it. And then, like a statistic, I'll call it myself, I got pregnant. And I was like, and he was seeking a president's role at another university. So I said, I'm just going to leave and go back to Prudential because I have to take care of this child. And in the midst of that, I had another child. And my dad is a Philadelphia firefighter. He's a retired Philadelphia firefighter. He came home one day, Crystal, the fire department is paying for people to go to paramedic school. I said, I don't want to be a paramedic. He says, well, you know, you should look into it, which I did, went through the training, became a paramedic, started the fire department in 1998, and I love my job. It is the best job in the world. So I've been with the fire department for 21 years, and I just rose through the ranks. So I became a paramedic, then a lieutenant, a captain. One of the things that I'm proud of but sad about is that I actually made history twice. I'm the first African-American female promoted to the rank of captain in EMS, first female African-American promoted to the rank of chief in EMS, which is great, but in this century, we shouldn't still be having first. So I'm a part of the executive team. I'm a deputy commissioner of EMS, meaning I oversee all of EMS in Philadelphia. We are a busy system, we're a large city, and it's a vulnerable population. And as you guys probably all know, a lot of our population uses the emergency room and EMS as their primary access to care. And so we see everything from Cece sickle cell patients to both of these ladies, maternity patients. You've named it, I've seen it, delivered babies in public bathrooms and all sorts of things. And as a part of the executive team, my boss, the fire commissioner, is a huge Twitter fan. So he's on Twitter. He sends me a flyer, Commonwealth Fund Fellowship. Crystal, you should look into this. I'm like, no, I'm not looking into this. I'm a little older than I look. I can retire next year. So I'm like, no, I can't do that now. He's like, I think you should do it. So every executive meeting we had, we meet every day at 1 o'clock. He would find a way to slip this idea into my head. And it was my adult son who fed my own words back to me. You know, Mom, if you don't do this, you know, how can you make the difference you want to make? And how can I not follow the advice I've given a million times over to both of my kids? So I applied, and gratefully, I was able to get in. Maria's in the room. I see her. I have to shout her out because we talked on the phone a couple of times, and she invited me to one of these visits, and I did not intend to come. Like, in my head, think Philly girl, I have the Philly talk, I'm definitely a Philadelphian. I'm like, no, I don't think I'm gonna fit in, I don't think I wanna go, no. So then the adult daughter, Mom, don't be afraid. So I came, and I fell in love with this place. I love being here. I love everything I'm learning. I'm learning the tools to be able to. I have a seat at the table. Marcella told me this in my interview. I said, I want a seat at the larger table. She said, no, you want a seat at the smaller table. And I said, that's exactly what I want. Like, I sit at the table with the mayor and council. I'm presenting to council on Monday, as a matter of fact. And it's good, and it makes a difference for my little small EMS system, which responds to 850 to 1,000 calls a day. But I want to be able to impact Philadelphia on a bigger level. So that's me.
Great, thank you. So, yeah.
Amazing cutout.
Yeah. So I guess we should start by just talking about what the Pozen-Commonwealth Fund Fellowship is. So maybe you guys could give us a little insight into that and how it's impacted your Yale SOM experience.
Oh, sure. Okay, so the Commonwealth Fund is a philanthropic organization that was founded by the Harkness family of Harkness Tower fame. Right? Where their mission really is to improve healthcare access, quality, and eliminate disparities, and they do that through a variety of ways. I think they have a variety of fellowship. One of the most well-known ones is Public Policy Fellowship at Harvard for trainees and physicians, and in reevaluating how that fellowship is going and are they meeting metrics, they thought about taking a new and innovative approach to health equity, health disparities, and as such, this fellowship was born. So the idea is to really use business and business knowledge to address some of these longstanding issues with healthcare disparities and health equity. And then thankfully, the fellowship was endowed by a generous gift from Bob Pozen, and has such become the Pozen-Commonwealth Fund Fellowship. So it's really a great opportunity for us as practitioners, all of us as practitioners, to get increased knowledge on healthcare operations, systems knowledge, also some fundamental business language as we learn how to address these inequities that are really important to us.
And then just to add on, I think it's actually important to know that when the RFP went out for the second fellowship, there were a lot of other schools that applied for it, and Yale was one of the ones that applied, and we actually obtained the second one. And so it's nice that with the foundation of Dr. Howie Foreman and Dr. Marcel Nunez-Smith and the whole SOM team to be available and to really, be leaders in acknowledging that we want something like this here at the school. So I think we're really fortunate that we were able to beat out a lot of other schools who applied for it. And so we're really, really excited about that.
Yeah.
Mm-hmm. And now, what does it add to your experience? You guys have, I think you've talked about immersion experiences and projects, so what's additional for you? Above and beyond Kanita's multiple degree seeking.
A lifelong learner. So I think one of the reasons I think Yale's probably selected is because it's such a rich environment for developing and understanding health equity. Mm-hmm. So there's also the Equity Research and Innovation Center here on campus, where there is cross-discipline communication about healthcare disparities, and everybody is kind of addressing it in their own unique way. So we've been able to be integrated into that. I think much like all of us who have come to business school, the biggest value is a network, right? Mm-hmm. So how we learn from each other, how we learn from our colloquium speakers and the people that we're able to access that we normally wouldn't be able to. And so I think for us as Commonwealth Fellows, that's also been quite tremendous. I think one of the biggest benefits has been the mentorship from Dr. Foreman, from Dr. Nunez-Smith, but also from people at the fund, like Lori Zephyrin, who runs a vulnerable populations portfolio, and having access to this wealth of expertise and knowledge that otherwise, you really, there's no price that you could get that for.
Mm-hmm.
No, go ahead.
I just want to add to that. So we actually had the opportunity to do an immersion for one whole week, and it was truly an amazing experience. For myself, I had been here for 3 years, commuting back and forth during the nursing program, and going on this. So we actually did a tour of Fairhaven and New Haven, and I actually had a newfound interest. I as someone who just comes in and leaves, not really being here and understanding the city of New Haven, what's going on, what are some of the needs. And so it gave me that perspective of not just someone who's a commuter coming here, but really understanding the community and how we work within the community. And so that was, I'm hoping that they continue that immersion, because it was such an amazing opportunity. We had the opportunity to have dinner with the mayor and talk to her about certain issues. We were able to go to the state capitol and participate in their healthcare forum. We met with the director for healthcare, the strategic healthcare. We met with some of the commissioners for public health for the state of Connecticut. And so it was an amazing experience to be exposed to those different elements. And like Cece said, the networking I think is really important, and realizing that there are a lot of people doing great things, and it's just getting all of us together so that we can strategize and think about how we can plan for the future. So I think that was an amazing experience.
Right.
Mm-hmm. So given that you have all of these resources and this incredible opportunity, can you speak a little bit about whether or not you've been able to take any of this back to your home communities, and how you've been able to apply this at your jobs right now?
I can do that one. Yes, absolutely. Having some of the business language has helped me. We last fiscal year in the fire department spent $20 million in overtime. We're a minimum staffing organization, meaning if someone is off, we have to replace them. We're heavy union in Philadelphia, and just in my MMD class doing the modeling, I'm like, there is a way for me to figure out how to decide whether to hire someone for overtime, move resources in other places. And my classmate, Chris Allen, is wonderful. He said, Crystal, I'll help you with that. So that's one of the big things. The other thing is I am a introvert. Like, I'm definitely an introvert. I'm off the chain. Every Myers-Briggs, you guys probably wouldn't believe it and wouldn't have guessed it, but I'm an introvert, and it's helped me to be comfortable talking to new people, talking about myself, which I'm not comfortable doing, and just networking and offering what I can give and trying to find out how we can get synergies with each other.
Kanita, I wanted to follow up on what you were saying about your DNP program. The Yale School of Nursing's DNP program is heavily focused on systems and healthcare systems, and I'm curious how you're finding whether or not that program is dovetailing well with this one, and what the juxtaposition between the two programs is.
Yeah, I think so. It's a little bit different. We have some business course within the DNP program, but I think this program actually takes it to the next level, and which I've talked to the School of Nursing to do more collaboration with the School of Management. So some of these courses like business, where you have experts here, they can cross over, because I sometimes I feel like nursing is very siloed, and it's very a niche area, and so I'm really interested in how to get nursing outside of that and looking at different avenues and different perspectives. And so for the 3 years that I've been in the program, it's been great because it's really focused on how do you manage large hospital systems? What are some of the tools that you can use to be able to do that? And I've been able to take a lot of those tools back to my work and have a different perspective. And I think with both programs, it's asking me the why a lot, like why are we doing this, what's going on, and not just being very task oriented. So right now I have a staff of 50 people, and about 40 of them are medical assistants. And medical assistants, most of them, some have a high school diploma, some don't. And so we're always telling them to do these different tasks. Like, we need to screen for colorectal cancer screening. We need to screen for depression. We need to screen for, retinal related to diabetes. But we never talk to them about the why. And so one of the initiatives that I have with my staff is every month for our monthly meeting, we have an expert that will come in so they can understand why they're doing certain things. And I think both of the programs together has given me that opportunity and that knowledge base so that I can, I think it's important to share this with other individuals and other people. And so just this last week in our staff meeting, we had, like I said, we have them doing all these screenings, but they don't understand why they're doing it. So we had the Director of Population Health come in and talk about why their roles are so important in being able to change healthcare systems and really get that foundation. And I presented on, population health and GDP and how much the United States is spending on healthcare. And a lot of them, it kind of went over their head, but I want to introduce some of these topics to them to really educate them, because I don't think we're doing that enough. And so I think we've done a lot of quality stuff and, stuff from out of the program. So I think it's great to see the two coming together and being able to share that knowledge with my team.
Yeah, well, I think the why is a really significant part of what most healthcare providers do. And so maybe, Cece, you could talk about maybe like your origin story a little bit in terms of how you became a pediatric.
Sure. So just spoiler alert, we all pre-introduced ourselves. I think that was what resonated with people. But so I'm born and raised in Detroit, and actually went to med school in Detroit and did my clinical rotations in Children's Hospital in Michigan, where I was on the pediatric hematology and oncology floor. And it was the first time that I saw an 8-year-old girl who had a stroke, an overt stroke. So she couldn't move half her body, and it was because she had sickle cell disease. And so it was a great rotation for me. I had a great team. I loved the knowledge. But when I saw that young lady, I recognized that there was an issue and something that I wanted to change. And so I was like, this is definitely for me. You know, I think for the patients I see, so just to be clear, I'm 80% research. I live in academics. And so I see patients only 20% of the time, but it's that 20% of the time that drives everything I do, because I realize that that could be my sister, that could be my brother, my cousin, you know, somebody in my family. And if I don't use the opportunity that I've been given to affect change in their life, then who will? So, you know, that's when I decided that I was going to do pediatric hematology oncology fellowship. When I did fellowship, I recognized that and understood from a data-driven standpoint that morbidity and mortality rises around adolescence and young adulthood. I recognized that I had the tools to change that, and there was a need, and so I moved forward with that. And like I said earlier, you know, I thought I was a little bit naive. I was like, we're just going to educate the patients and this is going to be great. But a lot of times in medicine, we put the onus on providers, we put the onus on patients. And truly, for all of my colleagues who are in healthcare, know the system is, or anybody who watches the news or has insurance knows that the system is not functioning optimally. And so I think to have the opportunity to understand that, to change that is fantastic.
Mm-hmm. Okay. So I want to be mindful of time and leave room for questions. So I guess we should go to our fun question about what could we not find out about you on LinkedIn or Google?
We should start with Crystal.
No. So Philadelphia again. We host several very large events. So the Pope visited. We had the DNC a few years ago. We finally won a Super Bowl and hosted the parade celebration. While the team in EMS in the fire department that handles those events is our special events response team. It's a bicycle and Segway team. So I was lucky to be, a little while ago though, I was lucky to be selected for the training. So I know how to ride a bicycle upstairs, over logs, and then at the end of the event, we rode bicycles down the rocky steps.
Mine's not that funny. In another life, I actually would want to be manage an NFL football team, and specifically looking at how CTE affects players and how we can do more to, help with the sport. So I love football. So there.
It's all downhill. So I love football too. I guess something you couldn't find out about me on the internet is that I also really, really love like African American art, and like to spend my free time moseying through museums and learning stuff.
Wonderful. All right, so I'm going to open it up to questions. Does anybody have any questions? Yeah.
Thank you, 4 women, for being on the panel today. You guys are amazing, absolutely amazing. Kind of going off of what you just said earlier, Cece, about the systems and how it's broken. And all of you really work with populations that are underserved. So how do you, because like I'm in the research world as well, we try to make changes, right, so that it helps everyone. But then how do you actually get to the population you need to help when quite often that population probably doesn't want your help?
Can I take that on too? So one thing as a paramedic that I would speak to here is what we've all mentioned as being healthcare being siloed. Everything is siloed. And I think that many of us in our industries and our organizations think from the inside out, and having lived in a vulnerable population, having served a vulnerable population, one thing that I think we sometimes forget to do is invite and include that population in the conversation early on. So whereas we may think, why don't we, start a well center? Why don't we open this and do this based on research? And part of what Kanita said is teaching people and including them in the story. So I am one of those very typical African American women. I have high blood pressure, I have high cholesterol, and I just hate medicine, right? So I know I don't take my own medicine. And we would go out and do blood pressure screenings, and I hear myself saying 100 times, listen, make sure you eat well, make sure you work out. Are you on medicine? Yeah, I don't take that medicine. Take your medicine. That one pill can save you from kidney disease and this and that. And I started hearing myself not following my own advice. So I would say include the people, educate the people, and really hear what it is they think will help them.
I think formally
And break down the silos, I'm sorry.
in academic medicine, there is like this emerging field of dissemination and implementation science, which I also study too, which talks about how do we increase the uptake of evidence-based guidelines into usual care. And what I have found, especially in the 6 months we've been here, is this mirrors like so many business concepts. When you're trying to understand like organizational readiness or community-based participatory research, which is what Crystal is talking about, or other kind of core concepts, these things are in parallel, but we don't get business training in med school, so we don't know. So I think that's part of the benefit of this fellowship is you learn how to look at these issues and these problems and these systems with an innovative perspective, and that's the thing that I think is really going to expedite implementation. Like, we need to start taking some cues from our VC colleagues and like bypassing all these grants and stuff, just kind of trying our ideas out and just making it work. So.
Other questions? No?
Oh, we're not done.
Nice try. I do have one final question. It's sort of a fun question, but I'd be curious to know if you could tell us who is your hero and why.
I'm not going first.
I'll go. I actually don't have one hero, and I look at someone who's a hero in a different perspective. And so a hero to me is someone who challenges the status quo, someone who isn't afraid to stand up for what's right, someone who is standing up for civil and for humanity, and that can come in many different forms. And so for me, that could be Colin Kaepernick, that could be Ruby Bridges, that could be Martin Luther King Jr., that could be Thurgood Marshall, Frederick Douglass, the list goes on. And then also not forgetting those who were victims of violence, and then also those who have been victims of police brutality. So for me, those are some of the things that I look at in a hero, and those are some of my heroes.
So as Kanita was talking about her hero, I was like, if she says my hero, I'm going to kill her. And she didn't. But for the same for the same reasons, my hero is Muhammad Ali. He's a fighter. One thing I love about him, and I try to remember for myself, he is not afraid to be himself. And that's what I do. I'm not afraid to be who I am. You're going to love me or not. He is also stands up for what he believes in, gave up an Olympic gold medal to stand up for what he believed in, being a conscientious objector. And I love him. He's my hero, and I still haven't gone to his museum, but I will.
Okay, I have a lot. I think for the purposes of this panel, I'm going to say my patients, right? Because so sickle cell disease is 100,000 Americans, increasing incidence, primarily African American, majority live in poverty. So the young adults I see as they're trying to kind of have a change in resources, as they're trying to be like normal teenagers, as they're trying to manage a chronic disease that the hallmark is pain, and they're poor, and the adversity that they overcome to take care of themselves, to make it to even my appointments, to live, to be happy, it holds me accountable, and I think it's incredibly inspirational. So I'm gonna say the kids I take care of.
Okay, all right. If you could select a couple of things, like maybe one or two things that you think would get the biggest traction in terms of improving outcomes or making the biggest difference for the patients that you guys serve, what do you think those things would be? I know it's sort of an unreasonable question, but.
Am I going for? Okay.
I'll go. I am one of those people that wants to wear the aluminum hat, so privacy is really big for me. But one thing that I noticed that does create difficulties with people trying to work across disciplines is HIPAA, right? So we can't freely share information. The fire department gets called for a morbidly obese 18-year-old that broke a sofa sitting on it. We only went there to lift him back onto the sofa. And we tried to reach out to his insurance company. He didn't have any medical problems, believe it or not, yet, because he was 18. And we tried to reach out to his insurance company because we really wanted to do the job of connecting him to services. And there was a no-go. There's like, oh, well, we can't talk to you because of HIPAA. We're like, we're giving you the information. Like, please hear us. So I think that's one thing, that if there was an easier way to share information while protecting people's privacy.
All right, I'm ready now.
Okay.
So I think it's an incredibly exciting time in sickle cell disease. In the past 2 months, we've gotten 2 novel therapies, where previously we had been using the same drug since I was born, hydroxyurea, and then we got like 1 drug a year ago. And then with the advent and understanding of gene therapy, it's becoming a really, really cool space. But I don't know that enough of my patients know, understand, or have access to all these interventions. And so I think increasing the understanding of the value proposition, I guess, since we're in business school, that people understand that optimizing care for these patients, providing these therapies, is actually better for us as a society. So just if I could capture that, would be great.
I think for me, it's having everybody at the table, the right people at the table making decisions, and having collaboration amongst different professions, I think is really important. And recognizing, for myself as a nurse, the importance of nursing and how they're really going to be leaders as we move into changing healthcare and you know, a more complicated healthcare system. And I think having that you know, that relationship where we're interconnected, we're working together, we're having collaboration, I think is really important. So currently where I work right now, my boss is actually the chief medical officer, and this is the first time I've actually reported to a physician. And it's really interesting because you have nursing and you have medicine working together. And so I learned from her and she learns from me, and we have a really great relationship, and we're able to, when we see things that we want to change, we're able to have a meeting, discuss it, and, you know, present it. And so when you have those small little collaborations, I think are really important. And so I would like to see that a lot more within healthcare.
So I'm really heartened to see that you guys are sort of experiencing the same things that I experience in my clinical practice too. And so I think that a lot of the themes that we've heard here are about breaking down silos and increasing collaboration, really making sure that we value all components of the healthcare system, so that we make sure that we maximize value at all levels of the value chain. And that includes patients, it includes payers, it includes paramedics, and I agree, Crystal, that the HIPAA issue can be a real obstacle. It slows down information communication, and I'm not quite sure how we fix that, but I think it is a real problem. So I thank you all for your amazing work. I'm looking forward to hearing how the rest of the program goes for you, and to see how you change healthcare. So
Thank you, Katie.